What led to it was that I'd had a tooth that was quite problematic, and I'd had root canal treatment on it. I had a series of infections. I had a conversation about the options available to me, and they were to have further root canal treatment, to have the tooth removed, and leave it at that, or to have an implant, and I chose the implant. It was the pain that was associated with the infections with the tooth, so it kept getting infected, was painful as a consequence. So the root canal treatment was the course of treatment that I'd had, and if you like, that had not quite worked for me, and that's why I was picking up some infections. So we obviously had that initial consultation and discussion. What was really impressive was Dr. Deepak explained really clearly what the choices were for me, and then when I said, well, I think an implant is the route that I want to go down, then really clear explanations of what that would involve at that point, and then at each subsequent step, because there were a number of steps in replacing the tooth. So for the implant, there was the removal of the tooth. There was allowing the gum to settle. Then there was putting in the implant itself, the fixative, allowing time for that to heal, and then having taken the measurements, fitting the tooth. So it was probably in the region of around 6 months. Could have been a bit longer.
Yeah.
It was the healing processes were the ones that put in the time gaps.
Great.
And also the time between a measurement and ordering the actual tooth itself. Yeah. It was more that I had questions to ask, and Dr. Papal handled those questions really clearly for me. And I like to know about the treatment that I'm having, so we had those conversations really at each stage, particularly so that I knew what came next. So yes, after the implant was completed, I felt very good about that. It resolved the problems that I was having with the tooth before then. It filled the gap in my teeth, which I'd had for a while. So that made eating a lot easier, and the tooth itself settled surprisingly quickly. Within a day or two, it just felt very normal and no more pain.
No more infection.
Yeah, so there was a planned checkup to see how things were. At each stage, what was very good was I always had a kind of contact number backup if I had any problems to contact and come and see my dentist again, so that was reassuring. On the basis of my experience, both with the implant and also with the regular NHS dental checks, I would certainly recommend this practice.